Welcome to Breaking the Silence, a podcast produced by Angels Protection, where we uplift the voices of young mothers and women and the leaders, clinicians, and advocates working to transform the healthcare systems that shape their lives. I'm your host, Makaila Davis, founder and chairwoman of Angels Protection, Inc. Her Voice in Healthcare is a series that is dedicated to women whose leadership is grounded not only in expertise, but in empathy, women who understand that healthcare decisions, policies, and systems must center the voices of those most often unheard. This series honors women who lead with integrity, accountability, and unwavering commitment to healthcare access. Today's guest is a healthcare leader whose work lives in the intersection of patient advocacy, access, education, and community trust, and whose commitment to service reflects the power of culturally grounded leadership and action. Dr. Harris is a retail pharmacist and pharmacy leader driven by a deep commitment to patient advocacy and expanding access to quality healthcare in underserved communities. She earned her Bachelor's of Science in Biology from Virginia State University and her Doctor of Pharmacy degree from Florida A&M University, both proud historically Black colleges and universities. Her HBCU education laid a foundation not only in clinical excellence, but in cultural competency, service, and leadership rooted in community responsibility. She also currently serves as a pharmacist where she's passionate about empowering patients through medication, education, compassionate care, and helping individuals navigate and overcome barriers within the healthcare system. Her work centers trust building, ensuring patients feel seen, heard, and supported at every point of care. She's also a proud member of Alpha Kappa Alpha Sorority Incorporated, an organization whose legacy of service, sisterhood, and advocacy continues to shape her leadership philosophy and commitment to collective uplift. Across her career, Dr. Harris leads with empathy, excellence, and a clear understanding that access to healthcare is not a privilege, it is a right. So I just want to take a moment to welcome you to the podcast today.
Thank you for having me.
No, thank you for being here because you are amazing. So,
Thank you. You say that.
yes, you are. So I just want to begin by asking what first inspired you to pursue pharmacy and how did your early experiences shape your passion for patient advocacy?
So I was first inspired with pharmacy the summer after my junior year of college because I was actually on the pre-med track in school, but when I shadowed at Temple Hospital with the physician, I quickly realized this is not for me. So that summer, I volunteered at the hospital pharmacy and I loved it. I fell in love with the medications, like the background of it, how they're made, how they interact in the body. So that's what pushed me to go into pharmacy.
I love that, especially how that experience that you had when you were shadowing the physician. That's why it's important to shadow people.
Yes, yes, very much so.
Yeah, because it will help you figure out what you can do. Um,
Yes.
so also kind of ties into my next question. So you chose to attend two HBCUs, Virginia State University and Florida A&M University. So how did your HBCU education influence the way you approach healthcare leadership and service today?
I would say my HBCU education has helped me show up at school. Our professors, they were very supportive and they would push us to give back to the community and be in the community to make it better. So with pharmacy, my goal was to be in community pharmacy because I wanted to educate the patients, especially in those underserved communities. They don't really have the background knowledge for how the medications work and why they're taking certain things. So that was my goal. That was what pushed me to be in pharmacy. I could give back to the community that way.
And that's really important too. Um, and HBCUs are very important to our communities. So I also wanted to touch on too. So as a pharmacy manager, you balance clinical responsibility, operational leadership, and patient care. What leadership skills have been most critical in navigating that role?
Mm, I would say communication, number one. That's what the team and with the patients. Just giving everybody space to say what they need or what we can change with the customers. Tell me what's going on, spend some time with them, especially if they have concerns about how medication is working, making sure I take that extra time with them. Everything's so fast paced, so it's kind of hard to do, but I try to make an effort doing that. And also, I would say empathy, having empathy for the patients. Sometimes it's crazy there, but I would try to take my time with them and because I know everybody's going through something and you get frustrated. So I would go that extra mile to have a conversation with them, make them feel heard and seen. Um, yeah,
It's important.
yes.
And making sure, I think also, as you said too, making sure that patients feel seen and heard.
Hmm.
And you do a great job at that. So it's really important. You do. You really do. So also too, what changes do you believe healthcare systems, particularly pharmacy settings, must make to better serve underserved and marginalized communities?
I think I think they need to move away from being transactional. Like it seems like everything in the pharmacy right now is transactional and fast paced. It's not really patient centered. Um, I think they need to get back to it being patient centered and move away from meeting numbers and because that's not why we're there to dispense medications, spend time with the patient to make sure they know the side effects. We know what's going on, what they've experienced, or if they have questions. But yeah,
It's really important. And that's why we have great pharmacists like you that are doing the work and advocating for the patients.
thank you.
Um, Also wanted to touch on too, so um, medication education is a cornerstone of your work. So why is patient education so essential to improving health outcomes and reducing disparities?
I believe it's important because the patient needs to understand the full scope of their health. So not just the medication part, like just their pills, but also like lifestyle modifications and why that's important when taking medications as well. So sometimes I would have people pick up their insulin, but then also buying hot chips at the pharmacy and with me and my patients, like I'm cool with them. So I would sometimes, like if I had to help out at the front, I would bring them on just like you're not supposed to. Why do you have this? And they're like, oh no. But I would tell them like you're defeating the purpose of taking this medication. But I think they need to understand the full scope of their health, not just the taking the pills or injections. You need to stop eating the junk. Try to go on walks every day, move your body. So I think that's important for them to understand.
It's really important. And like you said, walks. Something so simple like that is really important. It can make all the difference.
Yes.
Um, Also, too, I wanted to ask, so how can pharmacists play a stronger role in addressing health care access beyond the prescription counter?
Mm, I think pharmacists can play a better role in with advocacy, advocating for the patients, not just with the medication, but also with the barriers like insurance barriers, um, trying to find low cost, the most cost effective, I just drew a blank, the most cost effective, um, I can't think of what was I about to say. I'm sorry.
So you're good. I think like the most low cost effective options, right?
Yeah.
So, and
Yeah.
I think like you have been doing the work. And when I see you, I'm just like so amazed. I'm like, she's an amazing pharmacist. I'm like, it's a woman pharmacist that I know that is so close to me. I'm like, I just feel blessed because you just, I know most people aren't that blessed. So
You.
I'm
Yes.
like, she is amazing.
Thank you.
So now I'm like, oh my gosh, like ugh, I want to be like her when I get older. I'm like, she is doing it. She really is. Um,
You.
and also too to like tie in also, so like HBCUs have a long history of producing healthcare leaders committed to service. So how has your HBCU experience shaped your sense of responsibility to give back?
Um, like I think I said it earlier, but just so them at school being able to like support the community and us being really focused on giving back to the community. I think I've took that with me leaving school. And that's my mission now as a pharmacist. Like I want to give back. I want to help the people, sorry.
No, you're right. So you help the people, and I think really also too, it's like I don't know if the saying is like reach one, teach one, something like that.
Yes,
But
yeah,
make sure that we're always reaching back. I think when we all get to a certain space, I know even with me, I feel blessed as I'm able to break certain barriers, be in certain spaces and places, and then being able to say, oh, well, let me look behind me and see who I can bring with me because I know that this is something that I need to share, right?
hmm
So I think the wonderful legacy of HBCUs, especially the two that you have attended, do great work at that in producing leaders like yourself that are still doing the work and showing representation.
yeah,
To be blessed with a wonderful education, so then other young women that look like you could see it.
mhm,
It's a blessing. So
yes, yes. And I also wanted to mention with the HBCUs, they really, it's not just them teaching, but they truly like support you and guide you through. I remember my first semester at school at Virginia State, I had a hard time adjusting. So one of my professors, when I came back for that second semester, he's like, no, come to my office after hours, sit down and write out this study plan. You need to study this amount of hours for these amount of credits and follow this every day. So he was like strict about that with me. And I was in that library every day. And I got my grades up and I was on the dean's list. So they take that, I feel like they take that extra time and care with students that have a, yeah,
and it's important because you don't know where your students are coming from.
right.
So, and this thing, everybody comes from different backgrounds.
Yes,
So it's really important. And I think that's a beautiful thing with HBCs that they take their time with their students and they know that everybody comes from somewhere different.
yes,
Not everybody comes from money. You
right.
know, some
Mm,
people have to take loans,
yeah.
or try to stretch it out
Yeah.
for a couple of semesters. So I think that it's a beautiful thing how the professors, how they operate and like how he took the time with you.
Yeah.
And because he did, you're here.
Yes.
So
And that's how I want to be for someone coming behind me to be that support and guide them.
you have to. Um, And also too, wanted to touch on, so um, as you're a member of Alpha Kappa Alpha Sorority Incorporated, how has sisterhood and service influenced the way that you show up as a healthcare leader?
With Alpha Kappa Alpha, I feel like they help me show up as a leader because just so many women that's driven, well accomplished, like being surrounded by women like that just pushes you to do more. And knowing that I have that support with the sisterhood too, it just makes me want to be better and
It,
continue to do more.
it does. As you see, guys, I'm in my
Yeah.
year. We're in my 1908. Did
19.
not do that. We had to do it. Had to do it. Had to do it.
Yes.
The sorority is a beautiful thing, and like you said, it does make you want to be better. It does.
Mhm.
Even when you become a member, it doesn't matter what part of your life that you're in. Um, it will always, every single day, it makes you want to be better. It makes you want to do more. It makes you want to figure out how can I make my community better, right? And I can do that by making myself be the best professional woman that I can
Yes.
growing up. So even the days when you don't want to, it
Yes.
still makes
Yes.
you.
Throw up, still show up. Yes.
So, and that's the beauty of it. And, I hope that, everyone can experience something like that because it really is unmatched. There is no sisterhood
It really
like
is.
Alpha Cap Alpha. So, also wanted to touch on too, what does collective service through organizations like Alpha Kappa Alpha Sorority Incorporated and other Black sororities and fraternities teach us about sustainable impact in healthcare and community advocacy?
I think it teaches us that having impact, it can't be done in isolation. Like you need that community group
Right.
that's all focused on like the same initiative of trying to make things better. You can't do it by yourself, and you need that group. You need a group that's like-minded and has the same goals and want the same outcomes to push through. Because I feel like it would be more sustainable too, having everybody work together.
I agree. And I think the D9 is a wonderful thing. All the sororities and fraternities do great work, but there's nothing much
Yeah.
to say. I'm just gonna have to say it, but everybody does do great work.
Yeah.
Um, and I think it's a wonderful thing how we all do collaborate on events for the community. And it's really important, and I feel like it's a pinnacle, um, and that has helped the community in so many amazing ways, from environmental initiatives to public health to just regular community give back days. So it's really important on continuously showing up no matter what. Um, Even the mentorship programs are amazing too. I think that's really important, and to um, I think more of the community needs to know that we have these mentoring programs for the youth so that they can get their kids enrolled in it. And I think it's a beautiful thing to be able to be mentored by amazing men and women that are in the sororities and fraternities and having that one-on-one time. So for free.
For free.
For
Yes.
these are individuals that are really doing the work because
Yes.
for both the sororities and the fraternities, a lot of doctors and executives and leaders and
Mhm.
engineers and IT, just everything you can think of. So it really is a beautiful thing if folks can get their kids involved in that because yeah.
Would actually be amazing.
So I think that's one thing, just making sure we get are pushing our mentorship programs out.
Mhm.
Also, too, when you think about long-term impact, what legacy do you hope to leave through your work and leadership?
Mm, I hope to leave a legacy of compassion. I want to leave a legacy that people know that I cared, and for her patients and for her team, like just people around me, period. But yeah, I hope to leave a legacy of compassion.
And you will. You're doing it now. The work you do every day, I'm like, it's such. I tell everybody how much amazing. I'm serious. I'm like, my friend is a doctor pharmacist. That is amazing. No,
Thank you.
seriously, and it's a lot of work. It's a
It
lot of
is.
hard work. It's not easy, and I don't want anybody to take away from this that it is easy because it is not. But it's a beautiful profession if you decide to pursue it. But also tying into that, um, if you could change one thing about how healthcare systems engage with patients at the community level, what would it be?
Hmm. I think I would change. I would want them to be more engaged with the patients and the community around them. Like not just, oh, you're coming to the pharmacy for this. I would like the healthcare system to put out health initiatives in the community, um, do free vaccines for the community. Yeah, I think I want them to be more community based and patient inclusive because I think it's too transactional right now. So yeah.
And I think that's like healthcare systems across the board, right? Like it's very transactional in all facets of the
Mm,
healthcare system. Um, from clinical to non-clinical to pharmacy, public health, so insurance
mhm,
carrier. Um, so I think we all need to do a better job of being more using a collaborative approach for our
mhm.
patients. I think that's really important. And
Yeah.
also too, what message you want young women, future pharmacists, and aspiring healthcare leaders to carry forward from your journey?
I want them to know that they can use their voice, like whether it's they want to ask questions, don't be afraid to use your voice. Or stay resilient, be focused, and just know that you can do anything, just no matter how you get there or what your background is. Everybody has a unique way of getting to where they are. So just being confident and resilient.
I love that. Confidence and resilience. Those are really important because being a pharmacist is not easy. So you need to be very confident in yourself and being resilient every day and getting up and doing your coursework.
Yes.
You need to
Yes. Every
study
day I
your
have to
board
be
every day. You need to sit at that book.
Yes. Oh my
So
God.
I think that's really important. Also, too, I think also looking for sponsors,
Hmm.
looking for mentors, looking for folks that could be your own sense of community, someone that you can look and talk to and say, wow, like she is where I want to be.
Yes,
And you know, having that person in your corner through that journey is really important and could change all the difference. So
it
having
is.
a sounding board when those days are hard, is really important. So I think building a sense of community is really, really, really important.
Yeah.
Um, and being strategic about that too, not just having anyone as your mentor sponsor, because people will give any information. You want to make sure it's somebody that actually takes a
That
liking to
is
you and
true.
wants to pour into you and will
Mhm.
shout your praises and make sure you get into spaces and places and opportunities that can help excel. So
Yes, that is important.
it's really, really critical to touch on your point of what you said. Um, and also now too, the $1 million question, how can listeners stay connected to your work and advocacy that you do?
They could connect with me on LinkedIn. Um, my LinkedIn is Kristen Harris. I'm gonna try to be more active on there, but yeah, I could connect with me on LinkedIn.
So please, guys, take that as a wonderful opportunity to connect with her on LinkedIn because, again, she's a pharmacist in the community doing the work. Okay. And there's not many, it's far and few between. So here we have her on here. So take advantage of that. Um, and also, too, I just want to say, Dr. Harris, thank you so much for your leadership, your compassion, and your unwavering commitment to patient centered care. Your journey reminds us that health care access begins with trust and that advocacy lives in both big systems and small and everyday moments. For our listeners, if today's conversation resonated with you, visit angelprotection.org to learn more about our work supporting young women, mothers, and future leaders through education, advocacy, and community care. And remember, silence protects systems, not people. So let's keep breaking it together. Take care, guys. Bye. Oh, and like, comment, and subscribe. All right. Bye.